The idea of concierge, it's not just about luxury. I think it's about hitting all the areas you didn't even know that you needed or that you could have. It's helpful in ways that you didn't know existed.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Hope Pack. Hope is a dermatology nurse practitioner, the founder of Truly Dermatology, Concierge Dermatology Services. Welcome, Hope. Thank you for joining me.
Thank you so much for having me. This is pretty exciting.
Yes, I'm excited to talk to you and learn about this concierge dermatology. It sounds so fancy, but it actually reminds me there was a TV show on, it was like USA, it was like back in the day, and it's like Pain something. I can't remember off the top of my head, but basically it was a concierge doctor who lived out in the Hamptons. Like, I love that show. I was like, man, that's such a great concept of
Mhm.
just having the ability to reach out to a dermatologist or a doctor in general. But I would love to jump in and talk about that, talk about your new practice, but also want to kind of get some background because you've got a lot going on, and I'm so excited to dig in and hear about you.
Yeah, I have about, 9 or 10 years in a few different areas that all kind of go into the same thing. So I have my MBA. I have my MBA in marketing. So there's a whole business side of me that I think is constantly looking for gaps, areas of opportunity for everything. So entrepreneurs and all of that makes me a little excited, right? So there's that part of me. And then I have experience in wounds. I did several years in wounds. I worked in aesthetics for a while and then got into medical dermatology after that. So all of those things really played into where I am now. So I started Truly Dermatology, which we can kind of go into if you want how that actually began. But I started that with the idea of concierge medicine. So concierge medicine has always been, let's just say right now, just for the wealthy, right? So it's something where, you have your doctor on call, you get all this preventative medicine. And in our current healthcare system with dermatology, we see sometimes 60 to 70 patients a day. There are people who are shocked when I tell them that because that's why their experience when they go into a dermatologist is sometimes 3 minutes or 4 minutes. And maybe there are instances where you don't need more than that. You're just having someone check a spot, you're telling them it's fine. But I have really found that patients want more than that. They want to talk longer. They want to talk about all of their skin issues and they want to be more collaborative. That's just an area that is missing with however our medical system in the United States is set up. We're just missing personalization, we're missing customization to that person and collaboration. So I started to think about not only what I want as a provider, what I want to be able to provide, because I hate the feeling of being behind, knowing that patient's been waiting 40 minutes for me to get into a room, and knowing that they're starting off that appointment a little bit upset. And maybe they're having a really
Mhm.
bad skin issue like psoriasis or, something that's emotionally taxing. Maybe they're having something like that and they really want to talk about it and it's going to be an emotional conversation. And I know I have another patient that's been waiting 30 minutes that I have to get to. And that model, first of all, doesn't work for my personality, but I don't think it works for patients. I don't think it's
Mhm.
should be the only option out there. So I wanted to give patients more time. And then the other problem that I have always found in, let's just say medicine, is that it's 8 to 5 or 9 to 4, whatever it is, you're at work. You can go to the doctor, you can have an appointment if you miss work. It's crazy to me that everything is just open and
Mhm.
closed at the same time, and you can never get what you need at different times. So I really wanted to provide something where I see patients in the evening. If they need an appointment at 7 p.m., I can do that. That's not a problem.
Mhm.
And it actually works great for me because I might have my day totally open and I have 3 patients in the evening. Or, I'll see people on a Sunday If I have one appointment on a Sunday or two appointments on a Sunday, it's not going to kill me. I don't need to have every weekend available, and not every patient wants that. So
Mhm.
it's just to have that availability, right? So it's to say, you know what, I can see you at that time. So with Truly Dermatology, I have a set fee for a visit based on where they're located. I talk to them about what they are looking for before we go to the appointment. It is cash pay, so I can go into that a little bit more because I do want to incorporate insurance later, but that's going to have to be with memberships. It's just kind of the only way I can see that working with concierge. Um, but the fee is very reasonable for people, and I offer, different things with that too. So we talk about
Mhm.
what they want. I go to their house at the time of the appointment. So it's in their home. We maybe will do a full body exam and maybe Botox at the same time. Or if they want to talk about their psoriasis and we want to talk about all these options for what they've had, and they can only have their appointment in the evening. And there is a patient who's 21-year-old girl who works until 7 p.m. every day. She doesn't really work on the weekends and she would have to miss work, and her psoriasis is severe. So
Mm.
her making those appointments and getting somebody who she can text later and say, I don't know if this medication is working. Should I apply this to this area? Or they called me and they said they needed this. Am I supposed to send them my insurance or do you send that? Whatever it is, she can have that access to me directly or my MA to get those things that she needs. So it's about accommodation, and it's amazing that it just doesn't exist in dermatology. It's just not built that
Yeah.
way. That's what I'm finding.
Yeah. I mean, that convenience alone, I love this whole concept because when you do think about the workday, it's usually 8 to 5, and you got to take off time to go to a doctor's appointment or, schedule that out and make sure that you don't miss that appointment. Or if your day is busy and then you've got to cancel because, whatever comes up. But having that flexibility and the availability that you've got is absolutely amazing. So, my question is, how much time do you spend or block out for somebody if you're going to their house? Because I feel like me as a talker, I'd be like, oh yeah, so you want to have some tea or you want to have something
Yeah.
to drink and, have a conversation because I feel like you just get to know people when you're in their home, you get to know them really well, what their lifestyle is like, how it actually, having psoriasis, how that actually could affect their day to day. I mean, that alone gives you so much information just walking into their environment.
One of the ways that I schedule them for a certain period of time. So they do have so about an hour in the appointments, but it might be less, it might be a little bit more. And I really need to know beforehand all the things that they want to cover. So when I have my initial conversation with them, maybe over the phone, I'm asking them, are we checking a spot? Okay, I got to make sure I'm bringing everything for biopsies. Do they have something like a cyst or something, whatever. And there are some procedures I do, and that kind of will make the time a little bit different. And then I also will give like a discount if we're seeing somebody in your household consecutively. But the thing is that we probably won't even use that much time. It's just that that's
Mhm.
the time I'm giving them. So.
Yeah. So does your medical assistant come with you every time?
No, and in fact, mostly she works from home. She's incredible. So I'm so thrilled to have her on board, but she kind of does the everything. I don't need her necessarily for most things that I'm working on in the house, like for her to have with me, but she does so much back end coordination and calls the patients, and she still messages them and says, is this working? Did you get this? I called the pharmacy for you. She does it like a concierge medical assistant, that kind of one-on-one personal relationship with making sure they're getting those medications, making sure that they're not having any issues, whatever she needs to do. She does it. She's phenomenal. She does go with me to events. So we have been doing some events. Getting the word out is a little difficult. The marketing has been kind of difficult, but
Yeah.
yeah.
Well, and of course you've got that marketing background too, so you
Yeah,
got some experience there
I do.
already.
Yeah, that's true. Yes.
So, where do you live? Where's your practice at?
So I'm in North Central Phoenix. My
Okay.
home office, it's like an area called Moon Valley. It's a great neighborhood, but the best thing is that it's very central to a lot of areas. Scottsdale is to the east, Peoria is to the west. And then, you have like Central Phoenix to the south. I just do an extra travel fee for really far places. But people have been fine with that. I think
Hmm.
that the surprising thing, I thought that nobody would want to pay out of pocket to have this, but they do. They're fine
Yeah.
with it because they really want it. And it's not everybody. I had,
Mhm.
someone say, no, I don't want that at all. And I was like, no problem. That's great. I want to see if it's right for them. There are a lot of people it may not be right for, and that's fine. I'm okay with
Yeah,
that.
absolutely.
Yeah.
So, have you always wanted to be in dermatology space or a nurse practitioner in general?
Actually, yes. So I always wanted to be in dermatology, but then I had an opportunity to get a business degree for free. So I was like, oh, I'll do that. So I got my bachelor's in business. And again, I still loved marketing, but always talked about dermatology. And I was like, with my personality, I want to work with people. I want to help them with whatever is going on. And that's why I only do a little bit of aesthetics because I find that the medical dermatology is so much more satisfying to me. And so, yes, go get your filler with this wonderful person. That's wonderful. And I'll just do, some microneedling at your house, that kind of thing.
Yeah.
When I finished my MBA, within like a week of graduating, I said to my husband, I want to be in dermatology. And he was like, I knew you were going to say that. So it's like he knew. I had skin issues when I was a kid. I had eczema, I had allergies, skin allergies specifically to lots of different things. And nobody helped me with that. I even went to
Mm.
a dermatologist who said, I don't really know what you're allergic to. I don't know if you'll figure it out. And it was like contact dermatitis. I was like, wearing shoes and having horrible blistering reactions. And I would say, is this eczema? Is that what's going on? There was one doctor, I think he was just a general practitioner. He wasn't even a dermatologist.
Hmm.
And I went to him and I said, I'm getting this on my feet. I showed him, I teared up because it's so emotional to have to deal with these things. I was so sad. He just like put his hand on my knee, and he said, I'm so sorry you're going through this. I bet this keeps you up at night. And I lost it. I just cried because nobody had looked at this from the emotional standpoint of, yeah, I'm up all night. I am itching like crazy. And then come to find out later that it was an allergy to things they use in when they make shoes. But I had no
Wow.
idea. So I was like, I don't know which shoes I can wear. What's wrong with me? It was a nightmare. And I think I was so drawn to what he was able to give me from that emotional standpoint. He just made me feel like heard and understood for the first time. And I was like, I
Yeah.
can give that to people. So, in marketing, it's fun, but you don't get that feeling of being able to
Hmm.
like make someone feel like there's hope and like they feel a little bit better about their situation. You just don't get that.
Right. That's the thing about skin and dermatology. It is emotional because
Mhm.
it's something that you can see. So when you do have patients that have eczema and psoriasis and these chronic conditions, it has a huge emotional toll on these patients. So that is so needed when it comes to the whole concierge idea. I think it's so amazing because you're able to really give that personal touch. And I think that's what a lot of patients really want when they go to a doctor. You're seeking help and support, and you want to have somebody that's going to understand you and talk to you like a normal person, say, okay, I know this is keeping you up at night. I know this is bothering you, and we're going to get through this together. I'm here to help you. You came to see your doctor for a reason, and we're going to help you get through this. And I think that's what a lot of people really want. And that support is so important. But having that background that you have, that experience of that, I think that's where a lot of people they go into healthcare because of those experiences and knowing this is your why and why I want to
Yeah.
help other people because this has happened to me before and I understand. So that sympathy aspect is so important.
And, with the idea of concierge, it's not just about luxury. I think it's about hitting all the areas you didn't even know that you needed or that you could have. So
Hmm.
if you go to a really fancy resort and you have your concierge, they're like, what would you like us to purchase to put in your fridge? And you're like, I didn't even know that was an option to have somebody else shop for me and put it in the fridge, right?
Right.
But yeah, I would like that. That's really helpful.
Hmm.
It's helpful in ways that you didn't know existed. And so
Yeah.
that's the idea of concierge for me. And that
Hmm.
it's not just something that is for luxury, And so it is out of pockets, right? So there's going to be some people who say, you know what, I can't afford that. And I get that. I understand. But it definitely appeals to that group as well because
Hmm.
they love convenience, right? I mean, that's when you things are luxury, it's convenient. I can come to your house. I actually see a lot of men who hate going to the dermatologist, hate going to the doctor, don't want to miss work, but they have like a bunch of skin tags that they just want taken care of.
Hmm.
To have someone come before dinner, remove all your skin tags, and it's usually the wives that are setting up those appointments.
Yeah.
Like, my husband wants this, trust me, come to the house. And,
Right.
and the wives are like, I don't want these either. But it's so funny because you're like, I didn't know there were so many people who are like, I hate this, but I just don't want to go.
Right.
It's actually like a huge learning experience for me too, because I'm finding out so much about what other people want. As I started with no concept of how well this is going to be received. And I thought, well, like this is what they're telling me in my appointments. They want more time. They want this, they want that. Oh, if you came to my house, that would be amazing. You're hearing those things, but I didn't know
Hmm.
if it was really going to work out, and it totally is. So
Right.
it's growing, all the time.
So
Well,
you are also a complex wound specialist. So
yes.
what types of wounds did you work on or did you specialize?
So I worked in a wound clinic in Scottsdale and we did a little bit in the hospital. And I worked with a phenomenal surgeon, Dr. Brimacombe was his name, Sean Brimacombe. He was phenomenal. And I feel like he really kind of took me under his wing in a way and taught me so much that helped me as I went on into, just dermatology. Because people don't even know that wound clinics exist. Why do people go to wound clinics? I mean, a lot of people don't know this and they don't realize how difficult it is to heal. That when you have chronic conditions, when you have diabetes, when you have chronic kidney disease, when you have all these different issues, or even just blood flow issues in your lower legs, these wounds won't heal. And it is like a chore. You need compliance from that patient. Some of them are not even mobile or not very mobile, and you're asking them to do all of these things. And that is really difficult. It just shows how much you have to partner with patients. So I think I got a lot of that from wounds. So we saw anything from an accident, a stab wound, a gunshot wound, a boat propeller incident, like terrible things like that. And then you also see a diabetic ulcer, on the bottom of the foot, or an arterial issue where they're losing toes, or. Point is, we did a lot of stuff like that. And you see the difficulty that these people are up against, like all the issues. Oh, you say, oh, you need to wear compression socks. They can't get that compression sock on. They're not going to do it. How can you combat those things? So there are tools. You start to learn your tools. And if you're not looking at all of these factors when you're working with a patient, you're just not going to get the outcomes that you want. You need to look at all of those things. And if you're not looking at it holistically, is it because they can't make their appointments? Is their kid suffering from acne because they go from school and then they have sports 2 hours later and their appointment can only be in those 2 hours? Is that what's holding them back? What is it that's causing the problem and not being able to get the results that they want? I think that wounds really helped me with this too. I mean, kind of made this whole thing come together.
Okay, I was going to say, what was that pivotal point where, how did that influence your decision to go into dermatology?
Well, I think I always wanted dermatology, but then the opportunity opened up in wounds. So I was in aesthetics
Mhm.
first. And in aesthetics, I was like, I'm so glad I've learned all of these things in aesthetics, but this isn't 100% the environment that I am into. So, it wasn't satisfying in that way. I like doing, some aesthetics. I love making people feel good. That's the
Mhm.
nurse in me. So I love making people go, oh my gosh, I look so young, or oh my gosh, my face looks so, clean and pretty, whatever it is. I love that feeling. That's great. But still, there's a whole side of aesthetics that's like, I don't know if this is my personality. And kind of the reason I don't do filler, you know what I mean, or stay away from filler
Yeah.
is because that's a more of an art. And some people love it. And I say, go do that. And then
Yeah.
after that, I kind of went the polar opposite, but still in skin and healing, which was wounds. You have to understand wounds in dermatology, it's a whole part of it. And I will say this, as a doctor, I'm not a doctor, but if you're a doctor, when you have your training right before your fellowship, you do a long or a good size rotation in wounds because it's
Mhm.
so important. And then there's also an area where you focus on aesthetics. You do all of those things to be in dermatology. As a nurse practitioner or a physician assistant, you don't get that. You get a certain period of time, hours in a dermatology practice. And
Mm.
you're lacking a lot of the areas, so you have to kind of seek them out. And that's what I did. That is why I went into wounds with the goal of being in dermatology, but I want to have a better understanding of all of it. I need to be able to understand the aesthetic side, the non-healing, medical, vascular, all of those issues, and then you get into dermatology. And I think it's all encompassing. So I kind of
Right.
created my own education in that way by working in those fields
Yeah.
to get to where I wanted.
So outside of truly dermatology, you're also president-elect of the Dermatology Nurses Association.
I was, when I was a nurse, that was one thing that I thought again would kind of help me like get to where I was going to go. And so I did that, but that was actually kind of a difficult area. I didn't get to do a lot of the things I wanted to do. There were people who didn't have the same vision or
Mhm.
motivation that I had to get it moving.
Makes it hard. Yeah.
Yeah, I couldn't get to where I wanted to go with it. So
Yeah. But so are there other associations that you're part of now or
Society of Dermatology Nurse Practitioners just started a couple years ago, and so I'm a part of that. And I just reached out to someone in that because I want to take a bigger role. I like the organization of all of that. You know what I mean? I love the education side. I go to so many conferences, and I just want to keep learning and keep being at the top of my game. I learn things all the time. And I mean, I think we all do, but if you don't pursue that, then it stops. You know what I mean? You don't know what you don't know. So you got to keep going. And I'm also a part of the Phoenix Dermatologic Society. So the Phoenix Dermatologic Society is like 98% physicians. And then there's like a few nurse practitioners and PAs in it, but I want to get what they get. You know what I mean? I want to provide the same level of service if I can. Obviously, I'm not a Mohs surgeon, but again, so I'm part of that group and I go to their meetings and I always find out something. It's also where I find a lot of my resources and my mentors. I become friends with so many, surgeons and physicians. I can really learn from them. So I like to have my resources close. And so being a part of these groups is where I kind of create these relationships. And I also know who to go to when I'm up against a case I can't figure out, or if there's something I'm like, this is really tricky because I'm
right?
alone, right? So other people are in a practice. I'm not in a practice right now. I'm in my own practice. So there's not just one physician you can turn to. I turn to several different practices if it's something that I've come across that I'm like, you know what, I'm really not sure where to go with this one. And I'm lucky. I feel really lucky to have that and have developed those relationships. So,
Yeah. That's amazing. I think it's so important to have those associations and those relationships to be able to, like you said, stay on top of your game
yeah.
and continue to grow and learn because it's such a huge part of how we can help our patients. And it really just ties into the patient-centered care. And, I know you're a huge advocate of patient-centered care. And I think that is so important because you can influence that. There's some people that don't quite have it,
Yeah.
but that's something that patients are really looking for. They want to make sure that when they're going to a provider that they are getting the support that they need and that what they're looking for. It's huge.
And also, I think you find that I'm not the smartest person. I am not the best in the field of dermatology. I've never claimed to be that, right? I know exactly where I am, what I can handle. And I also know that certain physicians, they specialize in certain things. So I'm not going to go to this physician who I know doesn't really work with a lot of children. I'm going to go to this one, right? Who I know is phenomenal with children or board certified in pediatric dermatology. For example, Dr. Curran Lal, everyone knows him right now. But he's a board certified pediatric dermatologist. He's also a cosmetic
Yeah.
dermatologist. He has just been an incredible resource. I'm so lucky to know him on a professional level as well, not just like a personal level, but to be able to reach out to him and say, "What do you think of this kiddo?" And I will send a kiddo to him and he will love seeing them. You know what I mean? And
Yeah.
the patient loves that, I was able to make that connection. And
Hmm.
so if it's something out of my realm or something I can't do right whatever, I have people that I will always send someone to if I'm like, you know what, this is a little too complex or something I can't figure out. Or maybe just get an opinion from him. Should I change this medication? Should I alter this? He's just fantastic. You
It's
know,
all about the collaboration. I love
yes.
that. I met
Yeah.
him at Fall Clinical not too
Yeah.
long ago. He's such a great personality. So hoping to have him on the show soon.
Oh my gosh, he's amazing. Yeah, it would be phenomenal. So you'd love
Yeah.
it. I think one of the great things is that there are a lot of physicians who are like, I don't need to help those nurse practitioners and PAs. What are they doing? Oh, she opened her own practice. Whatever. We'll see how this goes. But he is like I think a teacher at heart. So I think he loves to share his knowledge. And so for me, like I said, it's all about resources. I'm not the top dog in the game. I need resources.
Mhm.
And it's nice to have those physicians that stand out to me
Yeah.
that are teachers and love to share their knowledge with you. That is just really great.
Absolutely. I see that same thing in my space as well, with the biologics and the prior authorizations and, just having that expertise. I mean, I'm continuously learning and growing from my colleagues. You kind of have to stay in the know and connected to people that are going to help build you up and help you enhance what you're doing in your growth and your knowledge. And I love that. I'm so excited for you with your dermatology concierge service. I love that. I just think it is so amazing to have that available for patients because people need it. People want that support and that service. And I love that idea. And I love that you're doing that. So I'm so excited for you. And, what are some things, lastly, just to kind of leave, what are something that you're looking forward to in the future? What do you have in the works for Truly Dermatology?
I want to grow. I want more providers. I want more nurse practitioners, physician assistants. There's something in dermatology. They do not have part-time nurse practitioners and physician assistants. It is so rare. So once a company has a full-time and maybe that person wants to go to part-time for whatever reason, right, to have their family, but they're phenomenal providers. And that company says, no, we'd rather lose you than hire part-time. And I'm like,
Mhm.
I just think that is amazing. They're losing such an amazing provider because of that and not allowing the relationships that they've built with patients. I mean, that says a lot about your company. That company is probably going to you because they love her
Mhm.
so much. So, anyway, so I really want to be able to hire more providers, especially people who like that part-time idea that are
Yeah.
phenomenal, but only want to do it 2 days a week or 3 days a week. You can still provide that, but I want phenomenal people who have the same sense that I do, understand what concierge means. So that's one. I'm also looking forward to memberships because I think that's going to be people want a little bit of aesthetics and then they want to use their insurance for the medical side. I'm still looking at it, but I'm excited for it. I think it'll be great.
Yeah. Exciting things. If any listeners are patients and want to find you and they're in the Arizona area, how can they find you? Do you have a website?
Yes. So everything is easy because it's 2 words. I don't shorten it, I don't elongate it. It's just Truly Dermatology. So Truly Dermatology on Google, Truly Dermatology is the website name, trulydermatology.com. And then Instagram is Truly Dermatology, Facebook is Truly Dermatology. So
Okay.
there are so many ways to get a hold of me, and I have a number out there and you can text, which is wonderful. You could text for an appointment. So I don't like calling and talking to people. I mean, I do. I'm saying it as a patient. And so I
Hmm.
love the ability to be able to just text someone. So
Yes, I love that. That's great. Well, thank you so much for joining me today. And I look forward to following you on Instagram and seeing all the success and growth that you're going to have. Look forward to connecting again.
thank you so much. I really appreciate you having me. It was actually a blast, not intimidating. It was wonderful.
Good.
Thank
I
you.
love that. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.